My friend has a 25-year-old son with Asperger's. Socially, he has difficulty fitting in with NT peers, and this frustrates him. He is angry that he is not normal. Only within the past few years has he begrudgingly acknowledged his diagnosis. Now, knowing this, he also adamantly refuses to associate with other people on the spectrum. He finds himself isolated and lonely, which only makes him angrier. He is not open to discussion about it. What might you suggest for my friend and his son?
He's trying to be a second-rate neurotypical when he should be a first-rate Aspie. So that's my view of the situation. First of all, many teenagers with Asperger's desperately want to be like everyone else and will have no tolerance of the word Asperger's. No, I'm okay. I'm going to push it away. I'm like everyone else. With maturity, he's 25. He may start to pick up that he does have some differences, but what I want him to start looking at is his qualities, not his defects. Sometimes it helps to have a mentor with Asperger's that he values. That is, he's 25, you get somebody 50 plus who is in his area of interest, career, somebody who's a hero to him, who has those characteristics, that is more believable than somebody in their patronizing way saying, you know, just be yourself. He's isolated and lonely. He needs to meet more Aspies and recognize that I'd like to explore with him what his concept of Asperger's is, who's explained it to him, what does he think it is, and then we go through Aspie heroes, the qualities and so on. So he needs a paradigm shift to see Asperger's not as a disaster and makes you second-rate, defective, disturbed, but it makes you a distinct individual with your particular qualities. Now, by better understanding himself, he'll be better able to explain himself, make friends, and to be able to make better career options that are to his strengths, not his weaknesses. So he really needs someone to work with him outside the family. Perhaps a counsellor may be able to do that, but I would like him to have a mentor with Asperger's syndrome who's been through it and say, I did that, that has credibility.
Dr. T, is
sometimes the autobiographies, yeah.
Is there a book out there about Aspie heroes?
Yeah, there are quite a few, some published by Jessica Kingsley Publishers and Future Horizons. Just check on that. It's really taking famous scientists, artists, etc., and recognizing that by being different, the world values their alternative way of thinking and creating. So it's seeing yourself as an advantage to society, not a disadvantage.
Excellent. The next question is, my son has been diagnosed as severely autistic since the age of 2, and he's now 16. He stims a lot, and given his 6 foot 2 inch, 260-pound frame, it's socially inappropriate. His stimming consists of running through the house, hitting the walls and countertops with his fists and the backs of his hands, jumping up and slamming back down with all his might on the floor, and then making loud barking noises similar to what somebody might make if they have Tourette syndrome. My question is there a medication that could possibly calm him, because the ones that we've tried don't seem to work? He also has an excellent behavior analyst who's well-trained and knowledgeable, but if our son is not calm enough to work, she doesn't seem to be very successful with him. Do you have any suggestions?
Yeah, you use the term stim. Ooh, when I hear the word stim, I go, oh, there's a lot more to it than just that, a self-stimulatory behavior. First of all, the person has suggested a distinct possibility, which is Tourette's disorder. And from the description, with the sort of mannerisms, actions, and so on, it could be a Tourette-like characteristic, in which case the person may benefit from access to expertise on Tourette syndrome. It has its own sort of medication, and it may help those sort of tics, mannerisms. So some stims are in fact Tourette-like tics. But there's another dimension, and that is routine. He has developed a routine that when he comes in the house, this is what I do. I go this, 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 and this, and he's got to complete the sequence. And so it could well be that this is related in part to emotion management and high levels of anxiety. One of the things that the guys know is by routine, as many people who have high anxiety know routines are soothing, will help, but also physical activity. And a physical activity is a good way of burning up the energy. So it may have value in it's a sequence or a compulsion that he's got to do as part of an OCD, obsessive compulsive component, but is also physically releasing his energy. So my approach to this would be looking at this as a sign of a high level of anxiety. Now, if that's the case, we need to be looking at a new routine when he comes home. There's a physical activity, but isn't so worrying or potentially destructive. So he's almost like a personal trainer rather than a psychologist, dare I say, not a psychologist, a personal trainer to create for him a new sequence of physical activities he can do. Now we find the first trigger. Now it can be walking through the door, means I now have to do this, this and this. So you may have a side door so that you start a new entry, a new starting point without the expectations of that sequence. But if you're going to use medication, it would be medication primarily to focus on anxiety and obsessive compulsive disorder rather than sedation. Now he's currently taking Risperdal, which is an antipsychotic. That's basically a sedative. He's obviously had a huge range of medications, but I would recommend somebody focusing specifically on medication for anxiety. But if he has a behavior analyst, we would be looking at behaviors that have developed to moderate and express anxiety. So we will look at the toolbox concept of a range of different strategies he can use to reduce his anxiety. This one works, but it's upsetting for other people. What we're trying to do is a substitute of other things that you can do in a toolbox of physical activities, relaxing activities, solitude, all those sorts of things, to help him calm down or express his anxiety or agitation in a more constructive way. So this is not behavior management, this is more cognitive behavior therapy to manage an anxiety-based ritual and routine.
Very good. And the last question for this segment is about hoarding. Is hoarding a problem that is common to people with autism and Asperger's? I know someone on the spectrum who has a very large collection of things that I would call useless, yet she refuses to get rid of them. I'm not sure whether to take it in stride or to deal with it as a separate issue. And this is from Inkspot.
What a lovely question. It is a problem, but it's different to other forms of hoarding. The person with Asperger's finds people very difficult to understand. They're intrusive, they're annoying, they're inconsistent, they tease you, a whole range of problems. But objects and your interests may be your great delight in life. And so the person may have greater enjoyment with objects and collections than interpersonal experiences. Also, not only are these objects associated with pleasurable experiences, they define your character. They are who you are. And so it's also like other people will look at photographs to bring back memories of enjoyable moments. Going back to the collection is a way of bringing back the memory of when you found it and saw it and so on. So it has many, many functions. And if you ask the person to throw it away, it's like asking them to amputate a couple of fingers. But you're taking away my identity, you're taking away my history. It's like saying to somebody, I want to throw out all your old photographs. People would object to that very, very strongly. But you've got to be practical. And what you may say is sort of culling a bit of it, how much of it is absolutely needed, and you try and keep it in particular areas, although I know people with Asperger's who have shipping containers in their backyard full. In fact, when we had the floods in Brisbane, some people with Asperger's I know had that, and the flood took away their containers of all their possessions. And their devastation was not the financial loss, it was basically their whole life history had gone in that container.
Oh, sure.
So I think in this sort of situation, it's trying to make a balance. It's saying, yep, I recognize it's important to you that you have these, but in practical terms, it's taking up more space. It's a fire hazard. All those sorts of things, people can trip over it. So we need to catalogue it, place it, put it in an environment that you know is perfectly safe. But you've got to say passage through your house rather than these things are going to fall on you. Okay?